really need to sort of talk about what this means for the healthcare provider, right? We have these digital tools, but like you mentioned, they are just a tool and it needs to be part of a larger strategy. So what would you say are really some of the key considerations for healthcare providers, investing in these tools, implementing these tools? And, how does Houston Methodist, ensure that health equity really remains at the center of connected healthcare initiatives?
Yeah, so when we think about the tools it for our providers, a lot of that's going to come down to educating the patients, right? And making sure that we have equitable communication and breaking down those silos, right? So our providers can do a great job, but what are they doing again? Working with patient access, working with our social work teams, all these pieces of that puzzle that come together when they think about what technologies are best in the practice that they're doing, right? Coming to our innovation team and saying, here's some of the things that we see, and we vet them to see if it makes sense for our patient population and continuing to lead in that area. It's also important it's hard to say in this day and age, that we don't need to have DEI, but we have to have health equity. You can't really have one without the other in a lot of ways, because you have to understand that we're still treating people. And so what does that mean, right? We may have AI and great technologies that don't require people, but at the end of the day, right, we have to be able to connect with people. There has to have that connectedness to bridge that gap. So I think, healthcare providers are trying to find, rightfully so, how do we treat our patients better? But we have to make sure that it's, again, that team-based approach, breaking down those silos and working together.
What would you say are some of the biggest challenges to really being able to move the needle in ways that, are sort of long past due at this point?
Yeah, I think this isn't necessarily a Houston Methodist issue at all. I think this is a healthcare issue, right, that I'll talk about. I think as we're putting the pieces of the puzzle together and trying to solve for health disparities and looking what health equity is, there's a lot of new regulations that are coming out, right? Not everybody has funding and access to some of this technology that we're talking about. And so what
Mhm.
happens to those organizations that don't have this? What happens to organizations as we're trying to solve for these that don't have community partners that they can work with, right? To be able to send patients out to make sure we have closed loop referral systems, right? And so I think that as we try to solve for these, if people don't have a strong plan for how they're going to do that and don't have access to the resources, all the regulations in the world aren't going to solve for making someone healthier, right? And so I think, there's lots of great conferences and conversations like the ones we're having today on how do you do that, right? And how do you do it effectively? I think you have to understand what you're working with depending on where you sit within your state, right? Your town, the country, and even the world, really, with your population, because not everybody has the same challenges and not everybody understands all those pieces of the puzzle that you have to put together to solve for this. But if you don't have community resources, you don't have technology, you don't have some of these other things, it will continue to be very hard. And if you don't want to educate your patients, because,
Yeah.
patients have to want to be educated on this and everyone learns differently. And so that piece alone is something, right, that has to be taken into account along with the type of research that we do. All these things we need to solve for right now, but we also need to solve for the future now too. So I think that's going to continue to be one of the bigger challenges.
Absolutely. Absolutely. And sort of on that note, I have one final question for you,
Sure.
which is what would you say is one or two really critical aspects of the conversation around health equity that are missing currently? What are we not talking about in this vital arena that really needs to be talked about if we want to see, the kind of progress that is needed to make healthcare more equitable?
I think it's hard. I think this is, you could equate this to sports, you could equate this to anything. I think it's hard for people to talk about what they're not doing well sometimes, right? If we see our patients leaving, we think that that's a win. But if we don't know what happens when they leave, is it? Right? So I think we have to start to acknowledge more what can we do better? We don't even have to call it what are we doing wrong, but what can we do better? And then what do we need to do it better? And
Mhm.
start to work really again with our community and with each other in the hospital. We are so busy day to day taking care of patients. But I think if we don't take a step back and start bringing teams together to solve that individual care that you and I just talked about a few minutes ago, that's never going to happen if we can't truly identify what is it we need to do better. Because at the end of the day, when we think about health equity, that's not based on your race. That's not based on your gender or your economic status. That's something that we all desire just as human beings, right? So it's not unique to one set or group of people. That's something that we would all desire. So we have to think of what do we need to do so that when and if it becomes us, we get that treatment that we want as well.